Hey, it's Dr. Amanda with ProAlign Clear Aligners. You might need something called IPR. So this is why I say the first or the second appointment, the first real appointment, is the longest appointment. So IPR is what we call Interproximal Reduction. And Interproximal Reduction is not unlike filing your nails, except for we're filing your teeth. And the treatment plan or the treatment plan set up and your doctor will know whether or not you need IPR. And that is removing a very fine microscopic amount of tooth structure in between the teeth so that the teeth move a little bit better. Now, if you have crowding, it's more likely that you're gonna have IPR. It's strategically placed. The maximum amount of IPR that you're gonna have is 0.5 millimeters. That's a half of 1 millimeter, which is like, it's such a small amount, you won't even probably see it with your eye. We use something called an IPR gauge to help us measure to see if we got it right. So you can see here, 0.3, 0.4, 0.2, 0.5, 0.25. These are super thin. Can you see how thin they are? These little things. And we're going to use little IPR strip. These are gauged according to width. So each of these is a different width, and it's like a little saw, and they saw in between your teeth. They might do it just as a finger file like this, where they just do it with their fingers. It might be on a stick, or it could possibly be on a handpiece, which is a rotary, okay? So you can ask your doctor exactly how he plans to do that. There's many different ways. I'm just showing you one way, okay? Once he does the IPR, if you're getting it, then he will measure it to make sure he was accurate, and then he will go ahead and deliver your aligners. And that's pretty much it. You'll get home care instructions, and that is the first major visit. From then on, you're pretty much home free. Your visits should be just quick checks to make sure everything's fitting, to make sure you're tracking, and just to make sure that you're progressing the way we anticipated. But usually, once we do that first major visit, everything else is home free and fast. So thank you for listening today. We're glad to answer any other questions on what to expect during your aligner treatment. Please don't hesitate to reach out and subscribe to our YouTube channel so you can get more videos. Take care.